Hi, Michael. How you doing today?
Doing all right. My knee's kind of killing me
Your
though.
knee's been hurting?
Yeah.
Well, my name's Tucker Gamble. I'm a student physical therapist working under Dr. Clausen. And he sent me in today just to do some what's called electrical stimulation. We're going to be doing it on your knee. And I'm going to describe that a little bit later on, okay?
Okay.
So with this patient with Michael, he's coming in, knee osteoarthritis. He has 8 out of 10 pain max, 5 out of 10 pain current. So for electrical stimulation for him, we're going to be doing it for pain control. So that's the biggest indication is he's been having pain and he wants the pain to be reduced. Any contraindications would include the pacemaker, cancer, pregnancy, any irritation of the skin, so any damaged skin around the area if he has thrombosis. There's a lot of contraindications for it. So I would ask him. I'm gonna ask him about that later on. But for right now, we're gonna come. We're gonna talk to the patient. We're gonna let him know what we're gonna be doing, and then I'll set up the parameters for you as well. So Michael, what we're gonna be doing is I'm gonna be placing these little stim pads around your knee, and what it's going to be doing is it's gonna send a little electrical current through your knee, and what it's gonna do is it's gonna feel kind of tingly, but we don't want it to cause any pain. And the whole point of it is it's gonna block some pain receptors in your back, simply put, and it's just gonna make it so that you don't feel the pain as much. And overall, it should help reduce pain in the long run as well. So this will just help control it, and especially for today, so that we can do some exercises and help improve your knee strength and mobility later, so you can push through what pain isn't there, right? Because it's kind of hard to move your knee around, get it moving, especially because it hurts, so you only bend it so much. But if we can reduce that pain, we should be able to move it through a greater range of motion, be able to move it more, bend it more, and be able to activate it more so you can strengthen it more. So that's what we're going to be doing with these. So in order to do that, I'm not going to have to move your shorts at all, but I'm going to have to place my hands on your leg. Are you okay with that?
Yeah, that's fine.
Yeah? Okay, perfect. So when we come over here, so we're going to take these pads right here. We're going to take them. So Michael, your pain, I'm going to place my hands on your leg, okay? So your pain is right here within the joint, right? That's where you're feeling most of it. So we're going to just take the pads and we're going to place the pads, make sure they stick down around that painful area. So we get the pulse running through the painful area. And what that's going to do is we're going to be activating the A beta sensory fibers so that we get the gate control theory. So it's just going to block the A delta and C pain fibers running up through the dorsal horn. And so that he only feels the tingling sensation rather than feeling the pain that he normally has. Then we would come over here to the machine. We're going to hit biphasic. We go normal. We're going to keep it continuous because we don't need an on and off time for this because we just want it to continually stimulate those A beta fibers. The ramp time doesn't matter because it is continuous. For this, we would go 20 to 30 minutes for the time. The rate, we're going to leave it at 50. And the width, we would drop down to 50 as well. So this just ensures that we only stimulate those A beta fibers so we don't get any muscle contraction, we don't get any extra pain on it. And then the intensity, when we go up on this, we're just going to ask him to go strong but comfortable, which just means that he's able to feel some tingling, but he's not able to feel any sharp or any dull pain. So Michael, I'm going to start turning this up. I'm going to start slowly at first. I made sure that he didn't have any rashes, he didn't have any open wounds on his leg before I put the pads on. And then I'm going to ask him as well, Michael, do you have a pacemaker?
No.
You don't have a pacemaker. Do you have any history of thrombosis in your leg? Nope. Any clots in your veins?
Nope.
No. Do you have any decreased sensation? Can you feel when I'm touching your leg?
Yep, I can feel that.
You feel it pretty well?
Yep.
If he was female, I'd ask him if he was pregnant. And on the medical chart, it would most likely have the rest of the contraindications. And as well, Michael, do you have any metal in your knee that I would have to be worried about? That's not necessarily a contraindication, but I would like to be aware of it as a patient.
No, my knee wasn't repaired or anything. No.
Okay, perfect. So with that, Michael, I'm going to come over here. I'm going to start turning it up. So I'm going to go slowly at first, and I want you to first let me know when you start to feel a little tingling, and then we'll talk a little more from there, okay?
Okay.
Okay, so we're going to start turning it up. Let me know when you first start to feel the tingle. Are you feeling any tingling yet, Michael?
No.
Not yet? Okay. Okay.
Starting to feel something.
Starting to feel a little tingling. Okay, so what I need is for that tingling, I need it to be strong but comfortable. So I don't want it to make your muscles twitch. I don't want you to feel any type of sharp pain, but I want it to be a little stronger than it is now.
Okay.
So if you start to feel any pain or any twitching, let me know. And until then, we're just going to go strong but comfortable on that. Okay, so that has actually maxed out the machine right there. But that's good because you're feeling the tingling, so we're activating those A delta fibers, which is what we want. We want to be able to turn it up high enough so that it does not activate any pain fibers, any muscle twitch. So that's actually a good parameter for him. So you are still feeling that tingling, correct?
Yeah.
Okay, so what we would do now is we'd let him go for 20 to 30 minutes. For the sake of the video, we're just going to go for 30 seconds. So we'd sit here. I'd stay here with him, make sure that he's not feeling any other sensations. So Michael, you're not feeling any like burning down your leg or up your leg, are you?
Nope.
No, you're just feeling tingling right there.
Yeah.
Do you feel a decrease in pain?
Yeah?
Yeah.
A little bit.
You don't feel the pain as much?
Yeah.
Okay. You're not feeling any other weird feelings elsewhere? You're not getting any flutterings in your heart?
No, this is pretty relaxing.
Pretty good. Okay, so if you ever feel any abnormal feelings, anything that feels off, you can, I'm going to slide this machine closer to you. You can press the red stop button if you were on it. Otherwise, we would let him sit here for the rest of the time. But since we've hit 30 seconds, we would stop the machine. And I'd say, okay, Michael, I'm going to go ahead and take this off for you now. And then from this point, we continued on with the rest of this treatment.